Hey there, humans of healthcare. I am so honored to be able to present to you Tricia Trammell. She is the Imaging Operations Manager for UT Southwestern at the Moncrief Cancer Center in Dallas-Fort Worth, Texas. So, have you ever been a patient who's needed an MRI or a CT scan or an X-ray or an ultrasound? There's a wide spectrum of radiology equipment and procedures out there, and the likelihood is, I think you've probably been exposed to that. Now, if you have been, you know, you walk into these rooms where these systems are, these big, enormous pieces of equipment, heavy, they call them heavy iron in that world, and there's somebody there to greet you and give you instruction and walk you through every step. Some of them are even on your headphones. If you've been in an MRI machine, you can hear them talking to you through all the other loud noises. But they're there for you. They're clinicians. They have training that is just as good as an RN. And they also have training on this cool technology. But their goal is to get the clearest picture or the clearest video to allow your clinical team to be able to see what's going on. Right? So they're very important in the whole healthcare hierarchy. And a lot of people don't know what they do. So Tricia's here to talk about a radiology technologist, what they're supposed to do. So if you're a patient who's getting ready to have a procedure, please watch this. If you've had a procedure recently and you want to kind of check to see, hey, was my experience up to par? This is a great video to watch. If you're somebody who's interested in working as a radiology technologist, they need you. And she'll give you great feedback on how to get into the right educational program to make sure you get to where you want to go. But then once you're in the program, she talks about leadership. She talks about keeping good people, what to do with talent, how to nurture people. And so I hope you'll get what you need from this. And then if you can, please share, because there might be somebody else out there that needs the same information. All you got to do is like, subscribe, repost. But if you have a question, Tricia is saying yes to a lot right now. She said yes to this interview, for example. She recently was featured in a magazine article. She's a part of her association. I think she's a board member. And then she also is writing articles for her association magazines. So thank you again. I hope this is informative. You'll see a lot more about radiology in the coming months. And I can't thank Tricia enough for helping us kick off this effort to bring awareness to the radiology technologists and the radiology department, the radiologists themselves, and the entire industry that exists around radiology. Thank you, Tricia, and thank you, humans of healthcare. More training that I see that comes out of this, I'm more and more encouraged by it. You know, I believe in the same things. It's like, if I don't come with that and I don't show that, then it's not probably okay for my people to do that, you know?
Absolutely. Yeah. Absolutely. I think it's very important also that your team sees you. They need to see you every day. Yeah. They need to see you in the trenches. They need to see that you're actually willing to get down there with them and work. I think a lot of times organizations will do things like they'll measure employee engagement, but what are they doing with those results? What does the team see happen as a result of those results? Yeah. They need to see action from that. Otherwise, it's just words on a piece of paper.
Right.
So I've been very upfront and open and forward with things like our employee engagement results, sending those results out to everyone so that they can see this is how we scored, and here's the results, and here's the action plans that we're going to put together, and make it collaborative. What would you guys like us to work on as a group?
Yeah.
And I make sure that everybody feels like they're part of it, because I feel like employee engagement is not one person's responsibility. It's not my responsibility alone as your leader. It's everyone's responsibility, because we all contribute to the culture that we work in every day.
Yeah.
And I feel like if we all enjoy the work we do, and we enjoy the people that we work with, and we enjoy the place we work at, then that's how we're going to achieve true employee engagement.
Completely agree. Well put. Yeah, it's more and more, and I don't know if this will make it in, so I'm just going to love talking about this stuff. I've got this happiness meter that I use.
I love that.
Yeah, and it's like red, yellow, green. Are you in that green on the happiness meter? And then I train my managers on what to do with the reds, greens, and yellows. And then there's also motivation. What's the attitude behind that? Okay, if you're yellow and you have great attitude, maybe it's a behavior or technique sort of issue that we have to work on. But the happiness meter is where it starts for me, and it's real. It's everywhere. We teach it from dawn till dusk almost, and we live it. And if I don't do it, then nobody else will probably do it. So it's like it starts with you, but everybody else has to take ownership too.
Right.
It doesn't work if they don't.
Right.
It can't just be me doing that.
Exactly. I also focus on what's in my sphere of control.
Yeah.
So when I'm talking with the group about here's our employee engagement and here's the things, but let's focus on maybe 3 things, but let's focus on the things that are actually in our sphere of control. So for example, maybe there's a measure that we didn't score great on, but it's about benefits. Okay, that's not in my sphere of control.
Right.
Let's not focus on that one.
Right.
Let's focus on the things that are in our sphere of control.
Yeah.
So I talk about that a lot with my group too.
Yeah.
Let's focus on the things that are in our sphere of control. Let's focus on those things, and then let's come up with a plan on how we can improve those things as a
perfect.
group.
Yeah.
And then when you get everybody's feedback and you get everybody's collaboration, people are more vested. They're more willing to actually follow through and participate with those things.
Yeah, completely agree. Oh, that's great. How many people are on your team?
I have about 15 direct reports.
Oh, wow. That's a lot. That's a lot. That's great. So what do you think some of the challenges facing your industry are, the whole industry coming up in the future?
Well, definitely staffing, of course, and you're gonna hear that industry wide.
Yeah.
And I definitely think, we're getting very creative in this industry on how we can combat staffing challenges, particularly with MRI, and there's a lot of things that are being looked at now with virtual cockpit as a way to help kind of with some of those deficits. And a lot of people are afraid of virtual cockpit, but virtual cockpit is not necessarily meant to replace an MRI technologist. It's really meant to support an MRI technologist and help if there's maybe a protocol or a particular scan that a technologist isn't really comfortable with. It's meant to support that technologist.
I got you. Okay, so it's almost like you're building in a hierarchy of support, which actually creates more opportunities, doesn't it? Okay.
Right.
Okay.
For example, maybe at this maybe all cardiacs are done at this one location, but if you have virtual cockpit, then you can have a technologist that does cardiac support cardiacs being done at another location, giving patients more options.
Oh yeah, I love that. So how long do you have to go to school to be a technologist?
So it depends. Typically for radiology, just for radiography and fluoroscopy, that's typically a 2-year program. And then to specialize in another modality, that's usually additional on top of the basic radiography.
Well, that's not bad.
However, there are some direct pathways for MRI, direct pathways for ultrasound, and direct pathways for nuclear medicine.
Good. Is it an expensive education to get?
Depends on which pathway you go, but there are a lot of community colleges that have the radiography programs.
Okay.
So just kind of depends.
I've noticed those, yeah. And this is a Gen Zer question. I try, because I have a daughter who's 23, so I'm a girl dad. I've got 2 stepsons, and I'm learning. That's all new to me, the whole son thing. But the thing that, when I say I represent them, it's because I've interviewed a lot of them, and there is a bridge between them and the mentality of the people who raised me, the baby boomers, right? And so I've done some interviews, and I really, believe it or not, I really kind of like the boundaries that the Gen Zers tend to have. They know what makes them happy. They know what their options are. They're educated about where they can go next and what the market should give them. And then I've had some of them tell me, and I thought it was really intriguing, I don't want to go through what they went through for a corporation and give my whole life away. Then look at them, they're not happy. And I'm like, hey, they got a point, And so I think people are going to be savvy. And one of the questions that comes up a lot from Gen Zers is what can I make in a field? I have to be candid. And some of the boomers are really hesitant to talk about money, and the Gen Zers are like, I have to know before I can make a decision what this is going to look like. So is there like a range that you could say that, if you went to school, you'll walk out making so-and-so amount of money that you would be comfortable sharing?
So I think that's a really interesting topic with the Gen Zers, and obviously my son is a Gen Zer, and we've had a lot of candid conversations because he wanted to know straight up, what am I going to make? And that is exactly why he went into MRI.
Nice.
And of course, as far as money goes, it's going to be regionally, because an MRI technologist in one part of the country is going to be completely different than another part of the country.
Sure.
And you're right, baby boomers, they feel like it's taboo to discuss your rate. They feel like it's inappropriate. Gen Zers, they're going to come right out and talk about it. And openly.
Yeah.
And Gen Zers absolutely demand professional work-life balance.
Yep.
They want fair pay and they want work-life balance. And if they don't get it, they will go somewhere else where they can. They want their work to matter. They want it to be meaningful. They want to do something where they feel like their contributions matter. But then at the end of the day, they want to go home and they want to have work-life balance and they want to go play pickleball with their friends and go to the gym and do their fun things.
Yeah, they do.
And if you can't give that to them, they will go somewhere else that does.
Yeah.
And they want fair pay for it. And that's the bottom line.
Yep.
You give them what they want, or they will go somewhere else that will give them what they want.
Yeah, and they're so good at doing their own research.
They are absolutely good. And the thing is, in this day and age, Indeed is putting pay ranges for positions right on with their job postings.
Yeah.
So with the transparency of most job postings, you can expect that, there is a min, a mid, and a max for essentially every job.
Yep.
And depending on your number of years of experience, you're going to come in. So if you're an entry-level MRI tech and, you're going to come in at the minimum, but you know what the range is.
Yeah.
And I think the challenge right now, and this is the biggest challenge that we're facing right now, is that each organization is changing their pay range in order to attract the workforce from another organization. And then what's happening is other organizations are having to do adjustments in order to either retain their current workforce or attract a workforce from another organization. And it's really tough.
It's really tough, and they're just pulling from one place, but it's hard to produce enough of the pool, make the pool bigger. That's really a challenge.
So organizations are constantly having to do market adjustments so that they can either retain their current workforce or attract a new workforce. And it's a real challenge.
Yeah, it really is. Yeah, so you have to be creative. And then it's going to be the intangibles, like you said, they feel like they're a part of something bigger than them.
Right. So one of the pieces of advice that I offer to my son when he's, evaluating things is and I offer this advice to all professionals, don't just look at your hourly rate. Look at the total compensation package.
Yeah.
The total compensation package, which includes what is the retirement matching, what is the value of the insurance and what your contribution is to the insurance, what is the value of the time off that the organization is offering, what is the value of the tuition reimbursement. So look at the entire compensation package. Don't just look at what the hourly rate is.
Yeah.
Because when you add up all the benefits, that's when you can really see the value of the employment offer.
Right. So Humans of Healthcare we're just now offering a service to hospitals. And the hospitals have been, frankly, missing the boat on becoming popular within the younger generations. And there's a lot of negative press out there, and it's on TikTok and it's on Instagram and places where hospitals frankly aren't. And I think it has a lot to do with the generational gap we were talking about, frankly. Yeah. And when I talk to a CEO, they'll say, isn't that the place you go to do, some silly dances and singing? And I'm like, no, it's really, really powerful, and people are on it a lot. and it's an entertainment source for sure, but there's a lot of really interesting stories going on TikTok. And so don't poo-poo it yet, but it's like, so I want to help them with stories, frankly, to get out into those areas where they aren't, because I think my gut is telling me that Gen Zers are going to make a decision based off of some popularity, and how is your organization out in the world? Does anybody know about you? I don't want to really be a part of something that nobody knows about.
Absolutely. TikTok is huge.
Yeah.
I get on TikTok every day.
Me too. Me too.
Because it's super relevant.
Yeah.
And you're right, Gen Zers are doing their research. The organization I work for, UT Southwestern, is the #1 hospital in the state of Texas.
Wow.
That's pretty easy to find, pretty easy information to find. Although I haven't found that information on TikTok.
Yeah.
But it probably should be on TikTok.
Exactly. Yeah. It's just, it's hard for some hospitals to put it on their official pages because, everybody's concerned about being sold to, and it's like, if you even get a little hint that it's contrived, that these stories are contrived, then they're turned off and they won't watch you again, frankly. So I think you got to be really careful about how you make the stories and where you put them and how they come out. If they're organic, I think you got a chance. But I'm hoping that organizations figure that out, how to play in that world, and understand the rules, because the rules are made by the Gen Zers. So you can ask them, and I think they'll tell you, if you don't show up in a way where you're in my world, then why do you think it's not important to be in my world? I would be offended, frankly, if they weren't where I was, but that's just me.
Yeah.
Yeah. So it's an interesting topic, but I think, to get awareness and get attention, let's try some of that stuff, because the intangibles outside of the pay, since everybody's competing at that level, they might help us. They might help some of our organizations win.
Definitely.
So we talked about how you get into the technologist game, how to become one. And so once you're in the game, what are some of the funnest parts of your job? What do you guys do as a team that's fun? What do you really think is interesting? Is it the technology that you use? Is it the patients that you deal with? What in your opinion is the best part of your job?
Well, I think it's really great that we get to do hands-on patient care. Of course, over the 25 years that I've been a technologist, technology has changed so much. I think that's one thing that's really neat about imaging is technology keeps on changing, and it's going to keep on changing. It's not going to stop changing, and technology keeps on getting better and better and better. And that betterment of technology requires technologists to keep on increasing their skills, keep on with education. Working in an educational environment like the one that I work for, we have clinical imaging trials, and that's a really interesting thing to get to be a part of. We're working with residents and fellows, so that's an opportunity for us to continue to improve our skills and communication as well.
Yeah, that's awesome. So some of the things, I come from the medical equipment service world, and I spent 20 plus years in that world. So I got to know some of the imaging technicians who service the stuff. And, one of the things that I was always curious about is what goes through the mind of a technologist when their equipment breaks? Does it anxiety rise? What happens in your world to almost disrupt what you're working on? And then where do your concerns and attention go once that event takes place?
Definitely there's some anxiety, and especially if you're in a leadership position, there's anxiety having to cancel patients, reschedule patients. And if you're working for an organization like mine, we often have patients travel even hundreds of miles to get to our organization they'll often come for a multitude of tests. So they're coming for labs, a physician's visit, maybe infusion, and imaging. So if they're traveling hundreds of miles and we're having to reschedule things, it can be quite off-putting. So there's a lot of anxiety if our imaging equipment is down. And of course, the first priority is how quickly can we get this repaired? Oh yeah, for sure. Yeah, I just always been, I've always known, I've seen the reaction of people, and it's typically you're at a heightened state when that happens and you're making that call for service. And then, I've also been out in the rural hospitals where they've only got one option to go to, and it could be life or death sort of stuff, right? If your CT down, it's not good.
and then the patients are going hundreds of miles away. But the thing that I've always heard is like, I just want everybody to know I'm down. I want everybody to stop what they're doing and help me figure this thing out.
Right.
Because it's like, I feel like you're put on an island when that stuff happens. You know, anxiety rises, and then you're kind of isolated, and then it's like you're thinking of other people and what they're going to feel, but you're kind of going through an event yourself, you know? So,
Yeah.
okay.
Yeah. It can just be so traumatic for a patient when their expectation was this and this and this was going to happen today, and instead we just rock their world.
Yeah.
And especially, you know, if you're dealing with a lot of patients who have had a cancer diagnosis, they just need things to go the way they thought they were going to go. They just need things to go as they were expected for them, and they don't need a monkey wrench. They don't need any kind of diversion in what they thought was going to happen.
Yeah, I interviewed a lady named Cara, who is an oncology director for a small hospital in Missouri. And when she told her story, she told stories of people that she's impacted through her department. You know, she was managing the radiology and all of oncology radiology stuff. And, you know, she got emotional about some of the relationships that she'd made, but she was absolutely concerned about every patient that came to the door. And I found it fascinating that somebody can give that much every day. Like, what kind of toll does that take on you and your staff to have people who are in so much pain or going through such a traumatic event? How do you cope with that?
You know, I find it to be a privilege to get to be part of a patient's journey. There's times when I'm delivering cancer results to patients. I'm calling patients on the phone and I'm telling them what their biopsy results are, and I'm giving them very life-changing news. And, you know, it may be the most scary and shocking news a person's ever heard in their life. It's the most pivotal moment that they've ever had. And I find it such an honor to be part of that patient's journey. I find it to be such an honor to be the person to get to share with them their educational, to get to be the person to educate them about their steps at that moment, to be the person to get to share with them what their next steps are. It's an honor. Is it easy? No, it's not easy to be that person, but it is a privilege and it's an honor to get to be that person.
Yeah. How do you keep your strength up for showing up the way you need to show up?
I think I draw strength from it.
Oh, wow. Good answer.
It doesn't drain me to do that. I think it is life-giving to me to actually be able to be that person. Yeah.
And once they find out the news, is the reaction typically just they want to know more information? Is that the genuine?
Not at first.
Okay.
When you first tell somebody they have cancer, they stop listening because all they heard was cancer, and then that's it. They really actually need a little bit of time to process the fact that they just heard the C word.
Yeah.
And then they're going to have questions a little bit later.
Yeah.
And because of the CARES Act, they're going to have their results on my chart. And once they get over the shock, they're going to go back, they're going to look at that pathology report, they're going to process, and they're going to start thinking about all the things I said. And they may go back, and I'm going to have sent them more information. So they may call me back. A lot of times they do. Or they may review the information that I sent them because I'm going to send them some information to review their pathology report more in depth. Yeah. But I get a lot of calls back. Yeah. Oftentimes.
Yeah, they processed it a little bit more. Do you have any angels in your life?
Well, I have 4 sons, and they keep me laughing all the time. Yeah. I feel like the team I work with, all my staff it just happens to be this way. I have a very diverse team of women. They're all women, but it's a real diverse team. Yep. And the majority of my patients, especially the ones I'm navigating through a breast cancer journey, are women. So I feel like I come to work and I have a fun group of women. Yeah. And my patients are primarily women. Yeah. And then I go home and then I have a boy house. Yeah. So it's a contrast. Yeah. But it keeps me energized.
Yeah. No, that's a great answer. I think, work, if you do it and it gives you satisfaction, it doesn't feel like work,
Exactly. Just like what I was talking about.
Yep.
If you love what you do,
Yep.
you love who you do it with, and you love where you do it at, it's not work.
Yeah.
It's just you're going to work to hang out with your friends.
Yeah.
And you get to do something that you love with people you love to do it with.
Yeah, and you're being productive.
Exactly.
Yeah.
And I really try to stress to the people that I work with, yes, we've talked about psychological safety, we've talked about, all those things, but every person that's on the team, there's not one person that's more valuable than another person. We are all doing something that really matters.
Yeah.
And we can't do it without another person. We cannot, none of us can do what we do without depending on another person.
Yeah.
We need people to check in our people, or we can't scan them. We need people to scan them so that we can get to the diagnosis.
Yeah.
So that we can call them and tell them this life-changing news.
Right. Yeah. Everything's pivotal. So when somebody on the team has a bad day, how do you chip in, and how does the team chip in for that person?
Well, I think my team is all extremely supportive of one another.
Yeah.
We do a lot of laughing.
Yeah.
And we do a lot of snacks. Snacks are great.
It's awesome.
I have a big candy bowl in my office.
Yep.
So everybody knows where they can come to just get away for a second.
Yeah.
Take some deep breaths.
Yeah.
And get a little snack.
Yeah.
And that definitely helps.
Yeah, that's great. So that's psychological safety. You have a safe spot for them to come to.
Safe space.
Yeah, that's great. I had a CEO tell me the other day that he created a coffee bar. It was for the patients, but it ended up being frequented by the nurses most often. And he realized, and he was a CNO, and he realized that although he created it for this thing, it ended up being something much different. And he was so proud of that, though, that it was a space for them to go to get that safety, take a break, take a breath, get your composure back and all that stuff. It's just, I can't imagine having to go from one event to the next without having that moment in between. So good for you.
I don't have one in this office that I have now, but in my old office, I used to have a thinking chair.
Yeah.
Just where people could just come and sit and just sit down and think for a little bit and get anything they wanted off their chest.
Yeah.
And it was a particular chair for you to just come and sit and unload if you want.
Yeah. Chair conducive for thinking.
Yes.
Yeah, I'd love to have seen a picture of that.
Yes.
The thinking chair.
And I had a particular picture that was just over where the chair was.
Yeah.
And it had a person sitting, just kind of, it had a picture of a face with a person kind of holding their face like this. So it just looked like a person that was sitting there thinking.
Yeah.
So that's why I called it the chair.
I get you. Yeah, deep in thought. You have a fascinating topic that you'll be touching on tomorrow. Two fascinating topics you're going to talk about. But one was, it's about the workplace, right? It's behavior in the workplace.
Incivility in the workplace.
Incivility, God, that's the right word. Yeah, so that I haven't seen that yet, and I've been to a lot of these. So, what's that all about?
So John Beal and I are co-presenting on incivility in the workplace. I just think this topic is super relevant right now because, just with all the things that are going on in healthcare, staffing, and just everything else, incivility is a huge problem, not just in healthcare, in all workplaces, and it impacts performance on so many levels.
Yep.
I'm sure you've heard of quiet quitting, and that is people just doing the absolute bare minimum they have to do just to keep their job.
Yep.
Why are people doing this? Why are people quiet quitting? Why are people just doing their absolute bare minimum they have to do to keep their job? And how does incivility impact performance? I'm going to talk about how incivility impacts performance and how just seeing somebody being treated in an uncivil way, how it impacts people's performance. You don't even have to be the victim of incivility. You can just see somebody else being treated uncivilly and it will impact your performance.
Wow, see, that's really profound. Because on the opposite side, you have oxytocin when you help somebody, right? And then your oxytocin rises, right? The person you help, their oxytocin, and then if somebody else witnesses it, theirs goes up, right? So it has to be true on the opposite. If there's incivility or, on that side, then it has to impact people around them. That's brilliant. That's a brilliant way to look at it.
It gets down to a toxic work culture impacts absolutely everyone. You don't have to be the person that's being treated that way. Just seeing it damages everybody.
Right. Yeah, that's a great point. And I guess I've experienced in my career, when you know. Like if you're aware that this can have an impact, then you know. And I've seen people who have acted oblivious to it, like it's not a real thing. And that was the worst for me, I think. Like, don't act like this doesn't exist, please. Let's at least call it what it is. And you put a term to it I hadn't heard before or used, is incivility in the workplace. And it's right on.
So we're going to talk about that tomorrow. We're going to talk about here's how we combat incivility in the workplace. Here's some methods for how we combat this in the workplace. And I'm going to challenge everyone. I'm going to give you some takeaways. Here's how we're going to combat this, and here's some methods for what you do, and then I'm going to challenge everyone.
Cool.
I'm going to challenge it. I'm going to give everyone a direct challenge to not allow it.
Yep, good. I think, like, my mom instilled kindness and consideration. She's a superpower with that stuff, and it's just easier to just do that all the time. I find that a good mechanism for me, but everybody's got, everybody can choose from a different choice, I think, and I can't wait to kind of see what your suggestions are to the team tomorrow, but great topic. And I've been picking up on, like, overall how important it is to set the tone for your workplace. And you take absolute accountability for, what's happening, around you and what other people are feeling, whether it's a patient or a coworker. And I think no matter where you apply that, you're going to have success, and so that's all really kind of great to reinforce, I think, on things like this when you're telling your story. But what about you, like, personally? Like, what is it that, if you were to want somebody to know about what drives you, or what you're in this for, what you'd like to see out of it for you? Do you have a vision board, things you're going after? What kind of drives you personally?
Well, I would definitely say, first off, I make mistakes too.
Yeah.
I think my leadership style is transparent leadership. And really what I'm going after every day is I'm going after a work culture where everybody feels important.
Yeah.
Everybody feels like they matter. And that's what I'm chasing after every day. I'm chasing after having a place that everybody wants to be there every day. And I kind of feel like I'm really passionate about these two things. I'm really passionate about that kind of leadership, that kind of psychological safety, that kind of workplace where people want to be.
Yeah.
We all work for, we're working because we need to work for money,
sure.
Right?
Yeah.
We're not working because it's necessarily, if I think about this a lot. If I won the lottery, would I still go to work every day?
Yeah.
The answer is yes.
Oh, yes.
Because I enjoy what I do.
Yeah.
Would I put up with, if I was treated poorly, would I still go to work then? If I won the lottery?
Yeah.
Probably not.
Yeah.
If I was treated poorly and I was just rich, would I still go to work every day? Not if I was treated poorly.
Yeah.
But do I love what I do enough that I would still come to work every day if I won the lottery? Absolutely.
Yeah.
I would still come to work every day because I love what I do.
Yeah.
So what do I want to do? I want to create the kind of culture where everybody that I work with would still come to work every single day if they won the lottery, because they find fulfillment and enjoyment in the work that they do.
Yeah.
Because they love the people that they work with, they love the type of work they're doing, and they love the place that they're at.
Yeah.
So that's really what I want to do. That's my mission.
Yeah.
And then the breast navigation is also something that's really important to me, and it's something that I really find a lot of fulfillment in, because I feel like it's an honor and a privilege to get to be part of somebody's journey in that very pivotal moment of that results delivery process.
Sure, yeah. I think I usually talk in terms of unique ability, and some people never find what that is because they don't stop and think about it. But I think you know what your unique ability is, and you know how to apply it to your world, and you're trying to make the world a better place by doing that. So that's it. You've got your why, and it feels, I mean, like everything you said has been really succinct and like, it's simple. It really is. It seems like it's very simple to you that, if we do these things, then these are going to be the results, and you can have an impact by doing those things. And it's radiology, it's imaging. It's really a cool field. It's going places. It's not stagnant, right? And do you feel like there's a personality type in the radiology technologist world? Do you feel like there's any commonality, or you said diverse earlier? Is it really a spectrum?
It really is,
Yeah.
and everybody on my team is so different. I've got shy people. I've got people that are real, over, extroverts. I've got people of, just an extreme diverse. I've got different nationalities. I've got different religions. I've got different I have different orientations. I've got just a real diverse group. The only thing that's not diverse is that I have an all-female team.
Right, yeah.
But the team is very diverse, and I think that there's strength in diversity, and there's strength in the diversity, just even with their personalities. But I think it's great to have diversity, but I definitely don't think that there's like a certain sort of stereotype that works well with radiology. Absolutely not. Everybody's really great.
Oh, good.
I think the only thing that I would say is that just like when I was talking to my son about potential career paths, I asked him in the most serious way, are you willing to serve other people for the rest of your life? This can mean anything. This could mean you may have to do some of the most basic human things for people for the rest of your career. Are you okay with that? He said yes.
Yeah.
And that's the only thing that I would say. What kind of people are great for radiology? The same kind of people that are great for anything where you're serving people.
Right. No, that's fair. I had a friend who did an interview. He's the most watched on this platform, and he's a perfusionist. And he's from Guyana, and he told a story about coming over and having so many challenges, but all he really wanted to do was take care of people. And he talked about bathing people, and he talked about all those things that he got enjoyment and fulfillment from, and even though he's a perfusionist and he's working in major surgeries and doing his thing and keeping people alive, it was the joy that he got from taking care of people. I believed him. I mean, that's the thing. He was so believable that he came all the way to the United States, fought all these fights, and whatever he went through was traumatic. Discrimination and all the stuff that he had to face at Cornell, Ivy League University in New York City. Like, you would think that, but he faced it all, and it's all because he wanted to take care of people. It was that powerful thing that drove him, was just that.
Wow.
Yeah, it was a great story, but I understand what you're saying, because of, there's other people that I've talked to about this thing that, and I think it's a great thing, a question to ask people who are coming in is that, are you willing to do that?
Right.
Sacrifice for that.
Right.
It's important.
I think some people go into different fields in healthcare and they go, oh, wow, I didn't know that I might have to do this.
Yeah.
Or I didn't know that I might end up having to do this.
Yeah.
And I think it's important that anybody entering any aspect of healthcare, that you need to know that you might have to do anything.
Yeah.
And you better be okay with that.
Right.
You might have to do anything.
Yep.
And you should be okay with that.
Yep. Completely agree with you. Well put. Is there anything else that you'd want people to know about the industry that we haven't talked about yet that, is like burning for you to say, like, look, there's this thing about this when you get into radiology or imaging that you have to know about. It's so cool. Or it's do we miss anything? I think in another question that came up while I was waiting, like that, do you match personalities on your team with patients? Is there some, like, when you have a feling about a patient, your team, do you ever work that from that angle? I was always curious about that.
No, just because, I've got my MRI team, I've got my CT team, I've got my X-ray team. However, I have seen, let's say a patient comes in and they're having a test, but but maybe they don't jive with this person right here.
Yeah.
I have seen, and it happens, where a technologist might just step away and another technologist comes in and their personality jives a whole lot better and they're able to just work with that patient a whole lot easier. Sometimes a tech just needs to step away and another tech just comes in and just a different approach, a different communication style, and they're able to work with that patient a whole lot easier.
Right. No, I was curious about that. I had somebody say one time that she had a really sympathetic person. She had a person who was more gruff. She had a person, and like she was describing these personalities, and it's like, and so she would know from the patients which one would respond best to that. She only had a few options though. I mean, you only have a few things, and so you want a well-rounded person, but at the same time, people have tendencies in their character, and it was like she was looking out for that sort of stuff. That was an interesting sort of way to look at matching, I guess.
Yeah.
Anyway.
Less ability to do so with imaging.
Yeah.
And a lot of our imaging, with these teams, the MR team, the CT team, they do a lot of things together. So one will get a patient back, dress, start their IV, and the other will be on the unit setting up the scan. So a lot of it is tag teaming. But if one kind of, the chemistry with that patient isn't good, then they'll do a swap.
Yeah. So when you get into your world, into imaging, and you want to, for whatever reason, you want to get into leadership and you want to take that track, like what was that, when did you know you wanted to be a leader in that industry versus others that just kind of stay the path?
That's a great question. I'm glad you asked about leadership. Yeah. So I was working for Baylor University Medical Center, and they gave me an opportunity to go to training for mammography. And I, shortly after becoming a mammography technologist, got an opportunity to be a lead. And that's how I ended up down a leadership track. I decided to get involved with AHRA. And AHRA has it's basically an organization that is really great for developing leaders. And I took the Certified Radiology Administrators test. It's basically a certification for radiology administrators. I strongly recommend anyone who's interested in leadership in radiology to become a member of AHRA and consider the Certified Radiology Administrators certification. It's a great pathway. So I did that, and I've been a CRA since 2011.
Okay.
So that's a great pathway, and at every annual AHRA annual meeting, they have it's called the basic track for new leaders, and you can go through that whole program. It's a great program. So there's some opportunity there. So I did that.
Okay.
And so that's a great way.
Yeah. So you went down this leadership path. Now, where does that lead? What are some of the places you can go from where you are in a hospital system, and how do you get recognized within organizations from your position, I guess?
Sure. Well, I think a lot of imaging people start out with positions down a leadership track with lead tech positions or supervisor positions. And then if they continue down that road, they're going to end up in manager positions and then maybe down a director pathway. And that's usually kind of where they're going to sit somewhere between a manager and a director.
Gotcha. Yeah.
And usually if they're falling in that pathway, they're going to, their education is also going to match with that.
Oh, I see. Okay. So when you get to that director role, is there like a VP level above that you can go to? And if you do that, does it tend to make you have to do more than just radiology?
It depends on the organization.
Okay.
At our organization, we do have an associate VP. Our organization is so large, we actually have 2 directors, one on the inpatient side, one on the ambulatory side, who both report to an AVP. But most hospitals just have a director, and then maybe have a manager that reports to them.
Okay. And a supervisor, leads, and different in the hierarchy. Now, when you're in the director or manager role, do you have responsibility for I call it P&L? profit loss sort of stuff? Do you have budgets? Do you get into the financial side of things in the business?
Yes.
Okay.
Yes.
Okay. And is that like, for people who have gone this track, is that something that you aspire to, that you like? Do you wish that you didn't have to do that part? Like, what do most people think once they get that responsibility?
I don't know what most people think. I mean, the budgeting part is not necessarily my fave, except for budgeting capital is definitely something that's anytime you're budgeting for something new, that's kind of fun.
Yeah, that is fun.
Because who doesn't like new
I know, right? And you get to go buy.
Yeah.
Yeah. And
budgeting for new stuff is fun.
yeah, that makes sense. I like that. That's a great positive way to look at it. So when you are doing the purchasing piece, right, you actually go through quite a process.
Yeah, there's a very long and arduous process for getting new things, submitting something through a capital request, budgeting for it, submitting it through a capital request, and then X number of dollars are what is approved for various budgets, and so maybe this is approved and maybe this is cut.
Yeah, yeah.
So it can be a pretty big process.
Yeah, I mean, that sounds like it. And then who has input? Like, you have to get clinical input, right? And you have to get, how does that work in your world? Is it the doctors that drive these decisions on which technology to go with? Is it preference? Like, how do they do that?
It's both. Doctors do have their input, and then we also have contracts and vendor preferences. So it's a combination of multiple things. And usually you let vendors in and come in and show their products, and we evaluate several things and let the radiologist evaluate several things as well.
Okay, cool. Yeah, in my world, coming as, it's like a long time in the world, I got to see a lot of directors it felt like you had it's almost like you had a pretty good amount of influence over the final say. Is that true? You feel that way?
I do think that the radiology directors do have a good bit of influence, and the AVPs, but I also think that, especially in a situation like an academic situation, the radiologists do have influence as well.
Oh, sure, that makes sense. And so you get new technology, and is it like when you put it in, is it excitement? Is there trepidation? Is it just like in a learning environment? What kind of happens to the department? Do you move things around? I mean, I'm not seeing it so much after the purchase, and what really happens on the day-to-day for you guys.
So I feel like in our situation, because we're an academic environment, we stay in a constant state of learning, because we have residents, we have fellows, we have clinical imaging trials. So, and we do have, when we get a new piece of equipment, of course, we have applications. So, and our fellows and our residents, they're changing out after a period of time. So the only thing that's really constant is change.
Right.
That's the only thing we can count on being the same. Is that things are going to change. Just when you get comfortable, we're going to get a new set of fellows, and then when you get comfortable, we're going to get a new rotation of residents, and then when you get comfortable with that, we're going to start a new clinical imaging trial. So the only thing we're going to count on staying the same is that everything's going to change all the time.
Yeah, so good expectation setting. It's just going to be like this.
It's going to change. That is absolutely the expectation.
No, that's good. Well, I appreciate that insight. I was always curious, and teaching institutions being so different than the ones that, especially rural hospitals, again, that's the spectrum, as they stay with that technology for so long, and it passed probably when they should. But then you got this whole other world that's just kind of bringing in the latest and greatest. It seems more exciting to me. It's just my preference.
It's pretty awesome.
Yeah, I bet.
It's pretty awesome. We do a lot of really interesting things that other places aren't doing. So it's pretty exciting.
Yeah, you're on the forefront of technology.
Yeah,
that's interesting. And is your son going to work at an academic institution, you think? Oh, nice, good, congrats. That'll be fun.
Yeah.
Wow. It's such a responsibility. We helped a rural hospital recently buy an MRI machine. It was the biggest purchase that they made in like 5 years, and it was a lot. It also brought this pressure, like this immense pressure, because they knew this was going to be it for a long time. It was such a big deal for the community, and I felt for them, because they were, but they had their hearts in it, and they did a great job, and they made the right choice. It's just it's just that whole experience for them was a little bit pressurized, I guess.
Yeah.
It's not bad.
Yeah.
Yeah.
So this program that my son went through, it was a partnership between a college called Tesla MRI and Dallas Community College and UT Southwestern.
Oh, wow.
And it's a program. Tesla MRI is an online MRI program, and UT Southwestern, it was an MRI apprenticeship, and it was a direct pathway to become an MRI tech. And the registry is ARMRIT, American Registry of MRI Technology. So it's a different pathway than becoming a registered technologist through the ARRT.
There's a flavor to every organization, and if you walk in and you know the flavor, better for the person walking in, better for the company that's done this, right?
Right.
Yeah.
So while these MRI apprentice to registered technologists, they may not be necessarily seasoned MRI technologists. They know exactly how we do it at UT Southwestern. And they're walking right into jobs that are available for them.
Yeah. Well, I mean, I could say this because I'm not you, and if I had the choice between somebody that knew my flavor and somebody that I didn't know that didn't know my flavor, I'm going to go with the one that did, because ramp up time, less risk. There's a lot to that. I think it's great. That's good for them. I wonder do you know who came up with this idea?
I am not 100%. I believe it was Elizabeth Chapman.
Okay.
She is the director on the inpatient side.
Okay.
I think it was a collaboration between her and a few others. And the person who is now over the program, her name is Dr. Jennifer Alexander.
Wow.
She goes by Dr. J.
Wow. So is PhD doctor? Wow. That's pretty impressive.
Yeah, she's great. And she's done a fantastic job with mentoring these MRI apprentices and keeping them on their toes.
Oh, good. Do you know how they promote this? Is it like, how do you know about this?
I think so they haven't really had to promote it.
Yeah.
So I found out they were doing it, and of course my son was at that time looking and trying to decide whether he wanted to do MRI or ultrasound. So I'm the one who told him about it.
Yeah.
And the other two students that were in the first cohort, they were like, I think one was a transporter and one was a tech assistant of another sort.
Okay.
So they were already internal. William was the only external person that got into this program, and the other two were already internal.
Wow. Yeah, they were employed. All right. So even that's easier to not have to go through any backgrounds and all.
So they haven't had to advertise this, because I think the word is out on the street that we have this, and people are really jumping to try to get into this.
Well, I love that sort of advertisement.
Yeah.
But in all due credit, the UT Southwestern folks, because you knew about it, and that's hard sometimes, because sometimes employees don't know what's going on in their own organization. Sounds like a simple thing, but I've been all over the place, and that just you don't take that for granted anymore. You know, so it's kudos to them to tell people and have word of mouth and all that stuff. It's not easy.
It's not.
No.
And back to the Gen Z thing, I'm really shocked at and surprised. Surprised is the better word.
Yeah.
That the Gen Zers are valuing some of the more mature benefits, such as pension, and our organization has pension and very generous pension matching. So when I'm talking about things like really look at the entire compensation package and evaluate the total compensation package, so brand new MRI technologists are looking at that, and they're seeing, okay, well, we've got a pension matching here, a very generous pension matching.
Yeah.
That's a really great benefit to evaluate there.
Yeah. It's like you line these things up side by side, and you see that one, and then they get curious, and then they go deep on their research.
They do.
Yeah, it's fantastic.
They do.
I'm so proud of them, and they'll find a better way to get there. And I think it's funny how it's kind of old-fashioned to go back to the pension stuff, and it really drove a lot of our past employment. And like my grandparents had pensions. My dad has got a pension, but it's rare now. So it's really cool thing to throw out there. Good on them for doing that.
Because we're like UT Southwestern is a state. It's considered a school,
Yep.
and it's a state it's a state organization.
Yeah, that's a great advantage.
Yep.
You got to use that stuff, right? Competitive as it is, that's a great advantage. No, I think that'll be good. Yeah, this is really informative. Thank you so much for sharing with your time with us, and I can't wait to get this edited and get it out there and show the world. This is our first radiology technologist interview.
How fun!
Yeah, you're the very first. I'm going to do many, many more in the next few months. Just because I think that there's something there that we need to try to get some exposure on. It's nursing. I think is going to be okay. I know that's kind of strange to say right now, but I think it's going to be okay. They got it figured out. It's just some of these other support factors that and organizations and departments that they don't get the same attention.
I'm so glad you brought that up.
Yeah.
I'm so glad you brought that up.
Good.
So my daughter-in-law, my oldest son, his wife is a nurse. But I'm so glad you brought that up because I definitely agree that while we love our nurses, a lot of times some of the ancillary departments, respiratory, physical therapy, imaging, we don't always get the same support. And that can sometimes, some of the supporting departments can feel slighted.
Yep.
They can feel unsupported by, hospital leadership, administration. They can feel like, and sometimes there's some inequities. Sometimes there's weekend differentials or there's critical shift pay that other departments, that supporting departments get, but it's not quite the same as nursing.
Yep.
So maybe nursing will get, a $12 critical shift pay, but imaging's critical shift pay will be $5 an hour.
Yep.
So there's some inequities that can really honestly sometimes create division in the hospital between supporting departments and nursing.
Very well said. I completely agree. And the thing that is coming out of this for me is that it looks reactionary from the healthcare perspective. If you're in general public, you're seeing there's a crisis and a reaction and a crisis and a reaction. And it's like, what about all the people who are keeping this thing going that aren't in crisis mode? Like you're doing all this special stuff because there's a crisis. But like you were just saying, what are these people who are the stability and who are struggling but are still stable? What are they thinking about all this stuff?
Right.
Right.
Well, and we need nurses, and but we need imaging too. And
Yep.
actually, imaging is what brings in the revenue.
Yep.
To the hospital. A lot of it. Surgeries is what brings in
Oh yeah.
a lot of revenue, but imaging brings in a good deal of revenue.
Yep.
And I think sometimes people don't always know, sometimes the nurses don't always know that imaging technologists have a minimum of, an associate's degree. Many of them have a bachelor's, and sometimes even more. So there's many at UT, many technologists that have bachelor's and even master's degrees.
Yeah.
So, there's respect
Sure.
that should be had
Sure.
for imaging technologists, and certainly some equitable issues that sometimes need to be addressed.
I completely agree. That's well said. I think it's fair to have this conversation. And I think, part of our job is to shine a spotlight on places that might get overlooked a little bit. That's what I'm here for, frankly. And you do it through storytelling. It's funny how this stuff comes up. It's not, this wasn't contrived. It's just part of our conversation.
Right.
We just happened, we could have ended this thing 3 minutes ago and it would never come up. But now it's like other people might want to talk about that, And
Sure.
I've always thought about radiology as the moneymaker. I know surgery has been too, obviously. There's a lot of risk in surgery, that comes with that side of it too, right?
Right.
But I've always thought that your department is a major source for revenue, and it deserves, because the stuff you buy, the things you have to have, and all that stuff. And I'm looking forward to the future with technology and how it's going to impact radiology. And I think it can be more. I think there's a pathway for the department to be more cost effective through technology. I see that coming, which might bring the spotlight back around to investing in that. Some of it's just business, it's all it really is. And I think you have the power, if as a group, to say, look, don't overlook us.
The common ground is always the patient.
Yeah.
The common
Right.
ground is we are here to take care of a patient, whether
Yeah.
your role is a nurse, a radiologic technologist, a physical therapist, a respiratory therapist. We're all here to take care of a patient, and that's what we should all be passionate about. Otherwise, we may be in the wrong field.
Yeah, right. One last question. What do you like to be called? What do your people like to be called? Radiology technologist? What term is best?
Technologist.
Technologist,
Yes,
okay.
definitely. And you will find that if you slip and call someone a technician,
Yeah.
they will lose it.
Okay. There's a company in Dallas that does MRI service, and I was talking to the owner, and he's in a lawsuit with Philips right now. It's a mess. But anyway, he would call technologist technicians,
Gosh,
but he would call his guys engineers, and I was like, and I thought, because I knew there was something not right about that, so I'll have to go back and let him know. You got to watch that, buddy.
Yeah, that's how you will end up in the doghouse.
Right.
Big time.
Yeah,
Big
I totally
time.
agree. Totally agree.
Yeah,
Well, thank you so much. This is awesome. I really appreciate your time.
Thank you for asking me.
Yeah, my pleasure. It's random how I get to people sometimes.
Yeah.
Like, I saw you're going to be at the show, and I looked you up, and that was it. I just thought, hey, I'll call as many people as I can at your organization, and you called back.
Well, I don't know if you looked in this month's ICE magazine. Did you?
No, I haven't. No.
Well, just so happens that in the month of February, they interviewed me for their cover story.
Yeah.
So I wrote, just so happens that for February, I wrote something called Rad Ideas, which is a column that they do every month.
I like that title.
So I did the Rad Ideas column for February about employee engagement, and then I was featured in their cover story. I contributed for their cover story. So
that's cool.
if you pick up their February issue of their ICE magazine, you'll see I contributed for it.
Oh my goodness. I mean, this was totally coincidental. I didn't even know that. I was like, I just reached out to you and you called back, and I'm so grateful. I was going to be here. I was going to, be here for a couple of reasons, but yeah, it was great, to have somebody call back. And we're actually getting more and more requests, as people get to know us better. It's like, it's becoming more frequent that people will want to be a part of this thing, but I never take it for granted. It's like, I just love it when people want to, come on and have a conversation. It's, it's fun.
Well, I think if someone asks me like anything about my success, my personal success, I've been able to be very involved with AHRA, and I've started to get more involved with ICE, and
Good.
I've, done some writing and a lot of volunteering and presenting. And I've just always said yes for any opportunity. If I've had an opportunity to write or present or be interviewed, I've just taken those opportunities as they come to me. So any opportunity that I've had, I've just said, sure, yes. Hey, would you like to present? Yes. Would you be willing to be interviewed? Yes. Would you like to write something? Sure.
That's awesome.
So I've just taken every opportunity that's been given to me, and if it didn't work out, it didn't work out, or if it worked out, great.
It's something you said at the beginning of the interview is sticking out a little bit more now, because you said I welcome the opportunity to be able to help people. It feels like you're attacking this the same way. When people ask you something, it's an opportunity for you.
Yeah.
Yeah, that's awesome. Good for you. Hey, this is your host, Danny Mobley. Thanks for watching Humans of Healthcare. Please subscribe below for more great interviews.